morning, I'm Diane Smith, and welcome to Capitol Report Morning Update for Wednesday, May 18th. We're glad you could be with us today. Here's the latest from the state capitol this morning. Now, of course, one of the biggest issues across the nation in the last couple of years and here in Connecticut is health care reform. The drive to get health insurance for every person in this state reached a big milestone in 2009 when the so-called SustiNet bill passed in the legislature. It was vetoed by Governor Jody Rell, but her veto was overridden by the Senate and the House. Well, that set in motion a drive to get the plan formulated, which included establishing a board of directors, 3 task forces, and 4 advisory committees involving more than 160 people. But in March 2010, Congress passed the Patient Protection and Affordable Care Act, which has then raised some questions in Connecticut. How exactly does the federal action affect plans that were already underway here? Well, it appears that there's been a new agreement between the governor and Democratic legislative leaders that will allow SustiNet to move forward. And joining us now to talk about how that will work is former Connecticut legislator Juan Figueroa, who is the president of the Universal Healthcare Foundation, and State Comptroller Kevin Lembo, the co-chair of SustiNet's original board of directors. Thank you both for being with us, and good morning.
Good morning, Diane.
Juan, would you explain what the original SustiNet proposal that was going into the legislature this year would have meant before we get to what the changes have been?
Sure, Diane, and I appreciate the opportunity. Glad to be here this morning. The original proposal was actually came as a result of a series of recommendations that were put together by the board of directors that you just mentioned. And in essence, those recommendations, which were turned into HB 6305, otherwise known as the SustiNet bill, in essence would have made it possible for the state to do several things, one of which was very key, to put together a business plan, which would be the next step, the next logical step in looking to provide a healthcare plan as part of the exchange in the year 2014, which is when the exchanges take place. So one of the key recommendations from the SustiNet board was to put this business plan together. The framework overall, if I step back for a second, explain SustiNet in the following way. SustiNet is a healthcare plan which is designed to be a nonprofit plan to be offered in the exchange, as I mentioned. That's one part of it. The other part of SustiNet is it's a commitment by the state to integrate and coordinate all the healthcare reform pieces and to better use its healthcare dollars that it spends on its employees and otherwise in maximizing those healthcare expenses. So if you look at SustiNet in those two ways, then the proposal that was put forth at the beginning of this year included a business plan for that healthcare plan to be offered in 2014. And in addition, it offers a series of steps to get the state closer to maximizing its own resources in terms of the money that it spends.
Mr. Comptroller, once that federal legislation was passed, did people then start to think, okay, now why do we need federal and state reform? How do these two things fit together, or doesn't the federal reform kind of take care of us?
Sure. Thanks, Diane. Look, it's a common misunderstanding that somehow we got down this road and then the feds acted, and somehow we could sit back now and let the feds do their thing. In fact, there was an original SustiNet proposal that was that morphed over time into this planning board, and that planning board's process worked hand in glove with both the development of the federal law and the beginning parts of the actual operationalizing of that federal law. So SustiNet is really built to use all the best parts of the federal legislation and then to do as Connecticut has done, for decades, and that is to innovate above what is a federal floor as described in the federal reform bill.
Now, Juan Figueroa mentioned the spending of the healthcare dollar that Connecticut spends. Of course, there are several different parts of that, including Medicaid, but there's also the state employees' healthcare and the retirees, and that's something that your office administers. So how closely do you want to tie those together, and what kind of authority are you willing to give over in how those dollars are spent?
Yeah, look, there's going to have to be shared authority over these populations as we move forward. But the background is that it's been the comptroller's office over years under Nancy Wyman's leadership before me that has really innovated around healthcare, has really sort of kept the ball moving forward. There are other parts of government, and I would argue the Department of Social Services is one of them, that may have lagged behind over time. They are coming up to speed really quickly. We have a new administration, which is different than the ones in previous years in that they are engaged in this issue. And some would argue for better or for worse, because they're engaged means we're not always going to agree on things, and so it becomes a little bit of a thorny conversation sometimes. So ultimately, $7 billion almost in healthcare purchasing around healthcare in 6 different ways that don't talk to each other is not only a bad deal for those who are being served by those programs, but certainly a bad deal for taxpayers. We need to get our own house in order, and that is part of what the SustiNet recommendations do, and we're committed to do over time. There are going to be some silos. There are going to be some, hanging on to your authority and not willing to share among some of these parties, but we're going to work through those and understand that over time and in a collaborative fashion, we can actually get to a much better result and save some money in the process.
And I'll ask you another question, and that is, how do the recent CBAC negotiations and the results of that affect the timing of all of this? Because one of the issues we've been talking about is pooling state employees and allowing other organizations to get in on the pooling. And I suppose that's right now a separate bill, but maybe merged into the SustiNet bill.
Yeah, I don't think it has a negative impact. There will be some pieces of the CBAC and the agreement and concessions that are going to have to be considered, specifically those around benefit design and others. But it's critical that as we move forward with that pooling concept, and that would bring municipalities in, about a year from now, and bring nonprofits that have business with the state in after that, that we are able to offer to these new entities a benefit design that makes sense for them, and a cost-sharing mechanism that also makes sense for them, because we have to assume that not everyone is either going to want to or can buy into the state plan as it's presently designed with its cost-sharing. We've made a lot of progress thanks to our division directors, Tom Woodruff in particular, and I think I should also praise the Speaker for his engagement on this issue. Frankly, there was a time not too long ago, about a month ago, where I thought this was all going south really fast, and if it weren't for the Speaker pulling everyone together, we would be in a far different place.
Well, I want you to explain a little bit about how that deal was reached, that, as Kevin just said, it looked like it could go south.
Well, I'm glad to report that SustiNet is alive and well,
Yeah.
yes, from what a lot of people perceived to be the case a few months ago. And I must join the comptroller in thanking the Speaker of the House, because what happened, in answer to your question, was there was a budget agreement. The budget agreement spelled out, as budget agreements do, basically line items of money to be spent in different agency towards a particular, in this case, towards for SustiNet. But there was nothing at all said concretely about what the infrastructure or what the policy direction of the state was going to be in using those monies. There was a lot of rhetoric. We heard a lot of rhetoric going around and bouncing around, and depending on who you were, you spun that in the direction you wanted it. So what's happened, though, is that the Speaker, though, once that happened, and everybody thought, okay, there's a deal, that's it, that's the end of it, the Speaker pulled everybody together. That's the administration, House, the Senate, co-chairs of public health, everybody that needed to be around the table, including us. We had the fortune of being there, and basically then focused on what is going to be the policy direction for the state of Connecticut if we have a SustiNet infrastructure. What would be the next logical step? So the Speaker's convening of everybody was a key point in making this happen. It continues to be, and I also want to do a shout out to the chairs of public health. Betsy Ritter and Terry Giarratana have been absolutely fantastic in moving this process along. But I want to say this about where we are today. You asked me before about the SustiNet board recommendations and what is the agreement in relation to those recommendations. Well, one of the key aspects to the agreement is that there will be a business plan, that a business plan will be done, that there will be the consultants hired to basically look into, as a business plan would do, how do you put together such a plan in order to be offered in 2014, and the time frames are in the agreement as was proposed by the SustiNet board. And then the other two key features that are part of the agreement that I think are very important is that there is a governor's SustiNet cabinet, a governor's SustiNet cabinet that is chaired by the lieutenant governor. In addition, there is an Office of Health Reform and Innovation that would be created with the proper staffing in the Office of the Lieutenant Governor basically bringing together all the pieces that I think you need to be able to integrate and coordinate all the elements of healthcare reform. I think that's a key aspect for us as a state to take advantage of the kinds of things that a comptroller is willing to do with respect to the administration of their health insurance program with state employees, as well as the other parts of our state agencies.
Let's just clarify where we are in the legislative process
Sure.
right now with this.
Well, right now, there is an agreement that was reached a few days ago. We are now in the process of sort of figuring out the legislative path for that agreement. There are several healthcare bills. The last count, there are sort of 8 major healthcare bills that are in the hopper, some of which are more controversial than others. But the bottom line is that I think over the next 24, 48 hours, we'll have a sense of which is the path that SustiNet, together with pooling, which are together, are going to take, as well as some other critical pieces that are out there that I think need to be part of the healthcare package. I think within the next day or two, we'll know which of the vehicles and where does it go, the House or the Senate. And the expectation is that by next week, we're hoping there'll be a vote in one of the houses on a healthcare package.
Mr. Comptroller, 2 things I just want to ask you that are slightly aside from this, but some of the things that we saw in the agreement, as much has been revealed about the union agreement, are the institution of something called medical homes, and we saw a press conference last week about establishing medical homes for people on Husky and some Medicaid patients. The other thing that we've talked about, or that we've just recently heard about, is trying to incentivize employees to take better control of their health care and to actually be healthier and resulting in savings. Let's talk first about medical home. What does that concept mean?
Sure. Diane, the background on this is that, there was a conversation about primary care case management in the Medicaid population for a number of years, and it went nowhere. Ellen Andrews and Sheldon Taubman have forwarded that in this building for quite some time. And that's really about making sure each of these patients have a medical home where there is someone coordinating their care from a clinical perspective, not from a cost perspective.
Right.
And that they're making sure that the best care at the best price is being offered to people, and they're getting the things that they need in a coordinated fashion, and that there is one central location where all of that data then feeds back so that this person can coordinate. On the state employee side, we've also made great strides. Again, through the Comptroller's office, we are putting together medical homes. We are in conversation with the large primary care practices around the state, and that is, depending on the group, in one phase or another of implementation. We're actually a little bit further ahead of the DSS initiatives, and that's going to bear fruit. And I think what's important about this and the other issue that you raise is that it reflects a new understanding about how we're going to deal with healthcare. It's not just about how do we drive down the premium, how do we increase the employees' copay and cost sharing, but rather how do we embed innovation in this system that will bear fruit over time, even when you don't see it immediately, because that's where Connecticut has fallen behind, not only on healthcare, but on infrastructure development and so many other things over time, is that we are so caught up in right now that we can never think about the long-term benefits of investing. And the governor's Yukon investment is part of that, that we're thinking 20 years down the line, not just 20 minutes.
So some of the things that we're talking about is trying to get employees to buy into things that will make them healthier and thereby reduce costs later because of the assumption that certain diseases would not develop. And also, I guess, for people who have manageable diseases, to make sure that they are really buying into the treatment that they need. For instance, that a diabetic is actually following all the aspects of care that their physician would recommend.
It's one of those things where, it defies past logic in that you really want to give access to maintenance medications, for example, for people with chronic illness. You almost want to give it to them because you want to make sure that they're taking it, that they're staying on the regimen, because for a diabetic, for example, it's much cheaper to pay for that medication and insulin and their screenings than it is to amputate limbs and do all the horrible things that happen if that diabetes is uncontrolled. And we've seen very good result in the state employee plan with that. Something as simple as a personal health assessment, where you just sort of list your weight, your height, your things that you're doing, are you exercising, all that, just in the filling out of the form and the reviewing of the form by the individual, people actually have been shown to make changes just based on that exercise of filling out that document. So, and then when it goes to the next step and it goes to the medical home and it goes to the provider who's going to coordinate care, and they work together in partnership where the patient doesn't feel like, oh, the insurance company's just trying to save a buck, that's why they're denying this, but rather there is a real conversation about the best way to coordinate care. Doesn't always mean more care. It doesn't always mean more expensive care. Sometimes it means less care and more exercise and those kinds of things. So these are, I think, among the most positive pieces of the agreement that has been struck between CBAC and the governor's office, and we should be proud of that.
Mr. Figueroa, I'll give you the last word here.
Thank you very much, Diane. I just wanted to say about this piece that it's a critical piece. Most healthcare economists will tell you the only way to bend the cost curve is to do exactly what the comptroller is talking about. And SustiNet and the work that the comptroller's office has been doing serves as a real laboratory to be able to do that and to have the state of Connecticut ultimately have healthier residents and a more cost-efficient system of delivering health care.
Well, thank you so much, both of you, for being with us and helping us wade through all the complex details about SustiNet. Juan Figueroa is the president of the Universal Healthcare Foundation, Kevin Lembo, the state comptroller, and on the board of directors of SustiNet. Thanks so much.